Welcome back, ladies and gentlemen, with our main topic today. As we said at the start of the program, that we are going to talk about the efforts that are exerted by the state to develop the healthcare system in Egypt. Well, to shed more light on this, we have the pleasure to have with us this morning our dear guest, Dr. Hoda Rizqana, professor of the Intensive Care Faculty of Medicine, Cairo University, also a former member of the Parliament. Good morning, Doctor.
Good morning.
Dr. Rizqana, how do you see the efforts or evaluate the efforts exerted by the state to develop the healthcare system here in Egypt since President Abdel Fattah al-Sisi came to office?
Honestly, I have to certify that since the era of President Sisi, healthcare services was taking up high to the highest international levels. And he's trying hard to update the system from zero to up.
Yes.
And this is very remarkable, and it pays a lot for a lot of sectors of the Egyptian people, especially it works for the elderly and the chronic diseases area and the areas of infection, of course. And with the presence of the COVID epidemic all over the world, I have to say there was a remarkable attention. And now they are devoting 17 million of Egyptian pounds to the healthcare services and to prevail the medical insurance to everybody on this land. Every Egyptian, since his birth till his, the most of the age. And what we see here is that we are enjoying a good chance, an excellent one actually, to prevail in our services and to extend it to as a model to all over the world.
Yes, yes.
And that's why I have to say to President Sisi, we thank him, and also we need to update the level of each sector in Egypt regarding the chronic disease area and the era of the sudden epidemics,
yes,
as we are facing right now.
Yes. Dr. Rizqana, also since President Abdel Fattah al-Sisi came to office, he launched several initiatives concerning the healthcare. For example, we have initiatives concerning 100 million health care, and also initiatives concerning the early checkup for women.
Yes.
Okay, for breast cancer,
and
also
for
the children.
Diseases.
Yes, chronic diseases,
yes,
and also for the young children.
Yes.
Could you give us your insight concerning this?
Well, as a matter of fact, this services was extended to the people for the first time.
Yes.
A lot of people, they were not believing that. I say, no, I don't think
this is the first time in Egypt that we witnessed
this is a kind of propaganda or something like that. But when they went to these centers, they were actually assured that this service is offered, and they were enjoying the benefits of this. And the lady came up from this checkup area and said, actually didn't pay anything. I have all my checkup and early detection of cancer also.
Yes.
And early detection of chronic diseases.
Yes.
This is very important. And sector of children's and pediatric health care will be served according to the budget offered to them right now.
Yes. Also offering these services at schools for the
yes, this is what I was
students.
asking for.
Yes.
We have to make a health service. Each school should have a small clinic to detect any errors in the health care of the children.
Yes.
And each one should be monitored and register cases of infection, feverish, any skin rash, any tonsils, and they have to examine the lymph nodes, as we can see that the epidemic of the, not epidemic actually, the infection of the smallpox
Yes.
for the monkeys, one of the diagnostic area, fever and lymph nodes. You can palpate the lymph nodes of the child, and this is a very, this is a red flag for each healthcare service. Why? Because it indicates that there is a severe fight inside the body of this child against the virus.
Yes.
So we have to take care of this monitoring data, and we register that, and we have to serve the cause, because when you treat the people with 10 or 20 person instead of 100 or 100,000.
Yes.
So this is a very, very big responsibility,
Yes.
and this should be implemented in the government, school, and private sector, and the international.
Yes.
Because international sector, they consider themselves, they are far away from monitoring or offering any services to their students.
Yes.
Actually, unfortunately.
Yes. Dr. Rizkana, how would the steps taken by the state and the initiatives raised by or launched by President Abdel Fattah al-Sisi would meet the plan of Egypt's 2030 for sustainable development concerning the health field?
Yes, of course. We are taking the steps according to the international demands and criteria of the
Yes.
United Nations.
Yes.
And that's why we are not missing any point which you can serve the citizen or even the farmers and the labor forces. And these are the bone, the bone of the society of Egypt. They are the pillars and the bones of this society. Farmers, if they are healthy farmers, and also healthy laborers. We have to take care of these people and the young generation coming at these areas, not only by birth control, but also by providing a health service which can support and maintain a health and well-being
Yes.
status for these babies, or even for the young generation coming up.
Okay, Dr. Rizkana, what about your opinion regarding the ambitious project of developing the Egyptian family, which was launched also by President Abdel Fattah al-Sisi?
Well, being a happy family is one of the aim which can produce a happy human being, and he can fight and defend his land.
Yes.
And that's why this is a smart area of services which provide the service and the intimacy to this land. You are intimate to this land, and this land belongs to you. So
Yes.
you have to belong to this land.
Yes.
And we are healthy and feeling good, not sick, not unable to work. Unable to work is a very dramatic situation to any person who used to work, as
Yes.
we all know.
Yes.
And it's not a happy situation.
Yes.
So that's why I think it provides a lot of empowerment to this sector and the people, and we also help to elevate the services of this healthcare service, and we offer distinguished diagnostic and rapid tools for enhancement of the health status.
Yes. So, Dr. Rizkana, concerning the overpopulation, which is a problem always President Abdel Fattah al-Sisi speaks about in several events. Concerning the developing the family, how would the idea of developing the family would help reduce the problem of the overpopulation for women and children?
Education plays a major part at this area.
Yes.
If the woman
is very well educated and conscious about her health, yes,
she will take care of this area by providing a good environment at home, a good supply of food to her children,
yes,
and a good mood. And also for her health, it will provide a monitoring situation which help her to embrace and develop embrace serving this country.
Yes.
And she wouldn't hesitate, of course, when they ask her do so, she will do. And because this serve her country and serve the future of her children. And they are all linked. As the woman is the pillar of the house and the family is the pillar of the society.
Yes.
And the man who's sharing her, if he is educated like her, he will help her, and he will never hesitate to control the birth of this family.
Yes, Dr. Iskana, concerning the idea of digital transformation when it comes to creating a universal health insurance and healthcare system.
Data is very, very important and very risky, that step.
Yes.
But we have to supply it in an organized way.
Yes.
And the people who are taking and registering these data should be very picky and very concentrating and educated.
Yes.
Because they will register a data which will be confirmed and assured that this belongs to this family. This man has 4 children, is age cat, and he is enjoying healthy life, or he is suffering from a chronic disease or hereditary diseases which comes to his family after his children, and he is unable to work or able to work till old age, over 60. So there is a lot of people over 60 and approaching 75. They are very enjoyable, and also they enjoy health and enjoy working. And they have a hell of experience which can be implemented and used in this area. We can provide them to be controlling any center of these centers to add and govern these services, which will be data to face the international competition, because they give awards every, our rank is what, 22, 23 among the world. We have to be keen to achieve the best of the ranks all over the world,
yes,
as we used to have always since
yes,
early dawn of age.
Yes. Dr. Iskana, concerning as we've just mentioned, the digital transformation, how would that help in the success of the health coverage for all citizens in Egypt?
Well, they divided the government. They started with Port Said, and
yes,
started as it's a model for digital information, and they apply the insurance service to these people, and they are moving now to other sectors in government in Egypt, Upper Egypt, and they will end up with Greater Cairo, which is the big start.
Yes.
That's why we are keen to have this data reviewed carefully and calculated without bet or false. And also the one who is working in this area should be very honest and do the job as is. So that's why we have to implement a lot of experienced people. We have to use people who are out of job right now to collect data and to add to these services a background of knowledge among their society.
Yes.
If they are in Port Said, if they are in Alexandria, if they are where they have original data for their society, we have to use them and make use of their information.
Yes. Dr. Iskana, concerning the role that is played by the civil society and also NGOs when it comes to raising awareness regarding the health initiatives and regarding means of dealing with the health challenges in Egypt.
Well, as I can see that NGOs can play a very positive part at this service.
Yes.
And also they can enroll the people who we cannot touch them easily.
Yes.
They are very near to them and they're very close, and they can speak face to face to them, not by microphones. So when you talk to the people face to face in their homes, it makes a lot of impact over this human being. So they will be responsive. They will be having the sense of the honor to serve their country. When
Yes.
you speak in a very nice language, not by orders, this will produce a hell of reflection. That's why we need to implement all the forces and take it as a martial law. We have this year this job, so we have to take it, govern it by each government. And we have to extend our legs and arms to the Sinai and Upper Egypt and the West Desert, all these area, remote area, it has to be engulfed among here these surfaces. They should feel it, and they should feel that each one is served by being an Egyptian.
Yes. So, Dr. Iskana, concerning the Decent Life Initiative, the Decent Life Initiative is one of the very important projects that was launched by President Abdel Fattah al-Sisi to provide around 53 million or raise the standards of around 53 million citizens in Egypt. So how do you see the importance of the Decent Life Initiative in the field of health that is going to cover all the governorates and even the rural areas here
Yes.
in Egypt?
Yes. This is a very dramatic point, because when you serve the people and help them to live in a healthy house,
Yes.
and a healthy water supply and clean environment around them and sunny house which can provide the sun. Our sun provides treatment to millions without we feel it, because we were guarded against a lot of infection and epidemics all over the world by our sun. So we have to believe in that, and we have to provide them with sunny areas of housing, not accumulated or compact, because this against the health. So when you provide this kind of life with a proper food supply and proper aeration and sports, and as the model the president gave us, and everybody was watching on TV, and they were unbelievable change in the lives of these citizens. They have everything provided and furnished also. So when we can see the reflection on these people, you cannot believe that this is the outcome which our president provided, and which we should serve for a long time. But luckily we have Sisi as a president, so he's providing the citizen with this service which were deprived of, and this is the right by doctrine. This is the right to have to provide them with healthy and aware environment and economic stability, and they can provide to their generation, the young generation, they produce secured and healthy and intellectual upraising to the level of their conscious and their awareness and their love to their land.
Yes, yes. Dr. Iskana, how do you evaluate the plans by the President Abdel Fattah al-Sisi and or the political leadership in order to face any challenge before we know that it's going to start? For example, when the pandemic of the coronavirus started, we feel that despite that no one has imagined that this would take that long time and the world was going to face this, Egypt was putting everything under control and as if ready for such a crisis. Did you get me? So also concerning the decent life, the initiatives raised by President Abdel Fattah al-Sisi or launched by President Abdel Fattah al-Sisi in many fields that was covering a large number of citizens suffering from the virus C, the healthcare
Liver
concerning the
affection,
women.
of course.
So could you give us or elaborate on this point?
I can tell you actually that his presence, without, I'm not flattering our president, but I say the truth. Since he provides these services and initiatives, the people working in the administration, they were, I mean, as if you shake them, because they were facing there is a lot of errors, and they were able to provide services and also solutions.
Yes.
When you provide solutions for such a chronic cases, it's a very good step to step ahead, and you will be registered internationally one of the best areas in the world which is healthy, and nothing. I can see that this area has that we can touch wood, that
Yes.
there is no errors in the epidemics area or that stuff. It's a very minimal counted area. The rate of death is minimal, and also we can see that the smallpox for the monkeys is spread all over in Copenhagen and upper icy area of Europe, Copenhagen, Finland, and all that, in 19 countries all over the world, and even the States. And though it's originally from West Africa, and it was sent by one passenger, and who was in contact with the people there, or it was like that spreading. So they also have to make an announcement here that we don't have to let the animals or pets in our home very close to us. And we have to provide a barrier for their, mouth secretions or their animals, their claws. They don't touch our skin. And also touching skin by skin is very dramatic, because it is the source of the spread of the infection of this virus. And this virus is working on the DNA of the cell, not like the COVID. COVID works on the RNA inside the ribonucleic acid. So it's much simpler, DNA, this one, and it can fade away as long as we have the health steps to prevent and guard against cross-infection. So crowds or touching skin, each one, or touching blisters of these people, or not noticing that there is a slight fever. That's why I said and insist that in the school children, there should be a health unit to provide any checkup for the young children to guard against any step for further infection.
Yes.
And it will prevent development of any errors in their health.
Yes. I thank you very much for your time. Thank you for your valuable information. I really had the honor to host you today. Thank you so much, Dr. Hoda Rizqana, Professor of Intensive Care, Faculty of Medicine, Cairo University, also the former member of the Parliament.
Thank you for this, and I wish everybody stay healthy, and God help and protect Egypt and protect our present force.
Of course.
And we have to salute all the people working in the healthcare service, and also guarding our borders.
Yes.
They deserve a lot of salute and respect, and God bless Egypt.
Yes, thank you so much. I thank you. Thank you for your time and valuable information. Well, with this, my dear viewers, I thank you for following me in this segment. I leave you with the rest of the segments of the Breakfast Show. My name is Aman Mukhtar.